Doctor.
Just keep this thing pressed once the incision.
So that's the platysma.
Yeah, you just
some
take
platysma.
routine places, people will know what is our preference.
Just ask her because she won't know.
Sterile தானா? இது ரொம்ப சின்னதுமா வச்சா குடுமைன்ற மாதிரி.
You don't want?
பார்த்து போகலாம் கொஞ்சம் இன்ட்ரோ ஆப்ல பார்த்துட்டு. Your aunt is my neighbor.
So that's the platysma.
Yeah, you just
some
take
platysma. Still some also. Would you like the discipline, Sarah?
Since we use a technique of pure cautery, that's the carotid. Sorry whether we are looking very good for the camera. Yeah.
This is my very close friend from Muscat.
Is the healthcare capital, I mean.
Without a doubt.
Mumbai. See all these level 5 and 4 notes. Most of it is not required to be removed actually, that is also there. Level 5 ma. Okay, now that's it, we have done.
Okay, perfect. Yeah,
We can take
that is
also there.
Give me anything. What is that? Forceps.
Side and solid, we should have just put a tie. It's used many a times.
Put it again. Let's see. No, doesn't work still.
Becomes very, very crucial. You have to lead, not just follow.
Yeah.
Answer. Okay, put it in. சரிம்மா.
ப்ளூ டவல் கொடுப்போம்.
திருப்பி எஸ் க்ளோஸ் அப்பில் just wash this nicely. No cost on it. No dry tanga bro.
Just relax a little.
Careful. Yeah.
They can put one combined drain. One here. Yeah. Put a 16 months long. Some people underrun, overrun.
Yeah, I just put it so it doesn't lose later.
Okay.
No, it doesn't matter.
Just keep these two separated.
Yeah, no, okay.
Sister, இது ஹெவியாக டூத் ஃபோர்ஸஸ் கொடுங்க.
வரல போடுங்க சார். You want me to blur it? Take the extension off?
There, let me come here.
So I just kept it in case of an emergency or something.
Yeah.
And very motivated.
Yeah, he's looking, sitting up and looking. Effective, and finally is the recovery also. If it makes a difference, we should do it. If it doesn't,
No need to waste time.
phone comes, huh?
Huh? In the surgery? I don't know.
That you can put the pieces inside. Clips கொடுங்கம்மா. கட் பண்ணிடுங்க. Just distracted or tired.
Well, remove that too.
இது மட்டும்
நான் எடுத்துட்டு ஃபுல்லாக பல்செட் வச்சு
Where's my phone?
Okay, thank you.
Thank you.
feed கொடுக்கணும் கஷ்டம்டா வேற இல்லையா அது உண்டு உண்டு
Okay, just turn it around.
Actually,
Yeah, that's the full
that's
position.
the way it is.
Yeah,
That's the way it is.
Perfect. Yeah.
Keep some gauze.
ஒன்றும் வேண்டாம் இதை எடுத்துக்கலாம் மூக்கணாங்கயிறுனோ நாங்கள் ப்ளீடு அதை பார்த்தாரு மூட டைப் யூஸ்வலி நான் அந்த நடுவில் எடுக்க மாட்டேன் சக்ஷன் ஆன் பண்ணுமா ஐயா ஸ்டிச் பண்ணாலும் வந்துருக்கும்
தாத்தா
Keep some gauze.
ஒன்றும் வேண்டாம்
Hi, this is a patient of ours, an elderly gentleman on whom we've done a major cancer resection and reconstruction. So what he had was a large tumor that was sitting inside his mouth, white element. So we had to resect his entire jaw on the left side, and we have used a flap from the chest. Okay, and you can see the scar there, that's the entry, and the scar also on the chest. So a pectoralis major myocutaneous flap was harvested from this area. It was tunneled and taken over the clavicle. You can see the clavicle on the left side is therefore a little bit more bulkier, and the muscle was taken down all the way in and was turned around and was used to reconstruct the mandible and the buccal mucosa along with the mucosa part of the lingual aspect that was resected because of the cancer. This is now 5th week, 4 weeks done after surgery. Yeah, he's able to eat well, okay, and he's considered. Yeah, so he has a little bit issue with the facial nerve because we had to resect the entire mandible and also part of the skin a little bit on the outside. Was a T4 lesion. He's doing very well. He's about 74 now. He's been able to. Yeah. So he's having soft, solid food. Still not gone to eating hard food. That's because he doesn't have much teeth as well. We're going to do that aspect of reconstruction after 4 more weeks. I'm going to show you inside the mouth. You see that? You can see the hair. So the hair bearing part is the part of the flap that was raised from the chest, and this would be how it would be normally. We also had to remove a lot of the teeth in the entire region of the upper and the lower jaw, as you can see. All the way to the midline, involving the teeth, alveolus, and also part of the upper jaw. Okay, I'm going to show you how he looks right now. You can show closer. So you see how it is now, and closer. Yeah, so you can see the flap that's attached from the lower jaw and also to the upper jaw and all along posteriorly. Oh yeah, sorry, till there. And there's also a lot of hair growing here now. So this is because this entire part of the tissue was actually from the chest. So that's what you can see now. So you see, this is the area we took the flap from. So you see this side, there's a lot of muscle. We took that pectoralis major muscle with a flap that's called PMMC, pectoralis major myocutaneous flap. This flap was harvested from here. It was tunneled, taken from over the clavicle. That's why you can see this clavicle still a little bit thicker than this one. taken from under the neck. You can see an incision here. See, this is a scar with which we had opened up and removed the full lesion. And then this was used to cover the defect. So all of that is nicely healed now. So this patient is unable to open his mouth. He's just come to me now, referred by another doctor. This has happened to him for a few weeks. Ever nala vaai thorakka mudiyama irukku ungalku ipo?
ரெண்டு மூணு வருஷமா வெத்தலை போட்டு அவங்க சேர்ந்துட்டுல வாய் திறக்காம இருந்து புண்ணு வந்தது பண்ணலாம் இந்த கிராம்பு போட்டு.
Okay, he has also some infection there. The teeth are in bad shape. We took a cone beam CT scan and you can see that there's missing mandible there. So the teeth are like literally floating. Yeah, why thoranga? Seri kadinga. So we're going to start a surgery for resection and reconstruction. This has come out as moderately differentiated squamous cell carcinoma. We're going to do a resection, neck dissection and a reconstruction, mostly for a pec major. Yeah. So this part of the mandible, this much is missing. It's been eroded by the tumor. So we've taken the scans already and found out the extent. They've also got nodes in the neck to the level 4. So we're going to be removing that as well, and then we're going to use the pectoralis major myocutaneous flap, and also require some implants to reconstruct the mandible. His mouth opening is restricted. However, it's not involved totally in the tumoral trigon. We're going to get that clearance as well. These are the cone beam CT scans of this patient who had this large malignant lesion. You can see the one here, this is the pre-op. So you can see the lesion that's extending this way, and you can see it going all the way up to the coronoid, and this is the post-op where we've resected all of that. We've used pectoralis major myocutaneous flap, a large one, to reconstruct the defect. He's doing very well, as you can see from this earlier video. This is to show that we had to do an aggressive resection. He's in his mid-70s, so we didn't consider the other alternative of doing a free flap, because this would give him a good cure and much improved quality of life and a disease-free state. So this is the cone beam CT scan of the same patient. You can see that the entire mandible is missing on this side, the left side. Also, we did a partial maxillectomy, and that's visible by the fact that, you see there? So it's just having a rim of bone there till the buttress, and there's no maxilla after that. So all of that, we've resected it out, and we use the same flap to reconstruct this entire defect. I want to also show you on an OPG maybe. You can see on the panorama, that's how the panorama looks. So you see that. We're also going to show you on axial view. You can appreciate the amount of maxilla that's being resected, and you can see now there is no mandible on the other side. So there's been a hemimandibulectomy plus maxillary resection. Okay, maybe you can see on the panorama, that's how the panorama looks. So you see that. We're also going to show you on axial view. You can appreciate the amount of maxilla that's being resected, and you can see now there is no mandible on the other side. So there's been a hemimandibulectomy plus maxillary resection.